to speak to our medical practitioner. He's actually a family medicine resident at Korle-Bu Teaching Hospital. Dr. Edward Djang has just joined us on the Africa Daily Show to walk us through the whole thing, the myths and the realities of breast cancer. Doctor, thank you very much for joining us on the Africa Daily Show.
You're welcome. Thanks for having me.
How's work going so far?
So far, so good.
Nice. No pressure, eh? I hope you had time to take lunch.
Not
Great.
yet.
Not yet. You see, that's where the wahala comes in. Anyway, thank you for making time. But quickly, breast cancer, the whole of October, some would call it Pinktober. The conversation has been there. The advocacy, the awareness has been all around, and people really need to be aware, more aware, because of the dangers involved when you actually develop this condition. But then, for the sake of our listener, what is breast cancer, and why is it so important? We should all know about it.
All right. Thank you. So, breast cancer simply refers to cancer that occurs in the breast. You know that cancers can occur in various parts of the body,
Right.
and the breasts are not spared, whether the male or the female breasts. They are not spared.
Okay.
Because of some frightening global statistics regarding breast cancer, the month of October has been set aside as part of a global initiative to raise awareness on breast cancer, particularly on the prevention and early detection of breast cancer, because these are the cornerstones of containing and treating breast cancer. If you find it early enough, you can offer quality treatment that will preserve life and improve the quality of life. So basically what this is about is just raising awareness on breast cancer. By way of statistics, let me just open our eyes to a few.
Okay.
Globally, each year we have somewhere between 1.7 million and 2.3 million people being diagnosed with breast cancer. Now, just you begin to think about what those numbers mean.
Yeah.
And out of this, we have about 500,000 dying from breast cancer.
Wow.
And the majority of those that are dying from breast cancer are in the developing world, such as in sub-Saharan Africa. So these are matters that are of grave concern to all of us, and we must all get involved in the drive and in the push.
Right. But by this, you made mention of over 500,000 people do die out of this over 1 million numbers you made mention. And the part where it gets too fatal, is it the issue of late detection? Is that what we're talking about? Or it's kind of like when it gets you and then, Charlie, no hope?
It is really sad that as many as 50 to 80% of our breast cancer patients in the developing world present late.
Wow.
They present at a stage where the interventions that are available are not curative. Okay. Now, if we catch breast cancer early enough, depending on the type of cancer we are dealing with, cure can be offered.
Right.
But if a person presents very late to hospital where you have cancer that has spread to other parts of the body and has so ravaged and debilitated the body, then in terms of cure, there isn't much that can be offered. But even then, we are able to offer what is known as palliative care, which aims at improving your quality of life.
Okay.
But we do not want people to get to the late stages. We want people to, we want to be ahead of the cancer. We want to be able to nip it early enough so that we can offer the best possible help to people. So 50 to 80% of people presenting late with breast cancer is simply unacceptable.
Right. I believe so. That explains, more of the advocacy and creation of awareness and all of that. But during your submission, you made mention of men and women. I love the fact that you included the man element in there, because most times, not until recently, I don't know how long, I didn't know that a man could actually develop breast cancer. Okay, it was just not long ago, maybe 3-4 years ago. But then, why is it more talked about in the space of the woman? Because let me just draw a little reference here. In the case of prostate cancer, it's more something that's more peculiar to the male figure. You get me? But is there anything prostate about the female? Is there anything like that?
So when we talk about prostate cancer,
Mm-hmm.
only men have prostate.
Good.
Women don't have
Right.
a prostate. So
Thank you for
women
that.
don't get
Thank you
prostate
for that
cancer. Right.
clarification. But when we talk about breast
Yes.
cancer,
Yes.
a man
So
can also develop. But we talk about the women more. Why?
yes, we do because 99% of breast cancer cases occur in women. It's
Okay.
1% that occur in men.
Right.
But in our campaign, we have not
Limited it.
pushed out the men. We are very much interested in the men because when
Mm.
we don't want to just look at a man as a 1% statistic. If a man has breast cancer, he is 100%,
Okay.
right?
Mm-hmm.
So yes, it's much more common in women than in men.
Mm.
But we are interested in both genders, and we are
Mm.
encouraging both men and women to get screened, to
Mm-hmm.
get examined, so that if there is any abnormal
Mm-hmm.
finding, it can be we can intervene early enough.
Right. But then tell us, what are some of the risk factors and of course causes associated with breast cancer?
Hmm. So basically, you have an interplay of genetics to
Mm.
an extent and environmental factors.
Okay.
So let me try and break them down into the risk factors that you can do something about, what we
Mm.
call modifiable risk factors,
Right.
and then the risk factors that you can't do much about, the
Mm-hmm.
non-modifiable risk factors.
Right.
So in terms, let me start from the non-modifiable risk factors. If
Mm.
you're a woman,
Mm-hmm.
you have as I mentioned, 99% of breast cancers occurring in women.
Right.
So if you're a woman, you have an increased risk of getting breast cancer compared to a man.
Mm.
If you have breasts, right,
Mm-hmm.
you have once you have breasts, there's always that chance of developing breast cancer.
Okay.
So you are not going to do anything about that.
Right.
And then if you have a family history, i.e., if you have somebody in your family,
Mm.
particularly a first degree relative, so say your parents, your
Okay.
sibling, or
Okay.
your child
Mm.
who has breast cancer, it increases your chances of also developing
Mm.
breast cancer.
Right.
You cannot do anything about the family.
True. Mm.
Breast cancer is also commoner with increasing age. So
Mm.
usually with women over the age of 40, you have an increased chance of developing breast cancer. Having
Okay.
said that, let me also say that we are seeing in some quarters an increased incidence of breast cancer in persons that are under 35 years.
Whoa.
So the age factor may no longer become
Be a
such a
case.
strong
Right.
point
Mm.
with,
Mm.
with the way things are going,
Right.
right?
Mm.
And then if you have your menses very early in life and you have the start of your menses very early in life
Mm.
and you reach menopause late, say if you have your menses, your first menses at the age of 10 and
Okay.
you have your menopause at 50 compared to somebody who had onset of menses at 15
Mm-hmm.
and then reached menopause at 45.
Right.
The one who started at 10 and ended at 50 will have a greater risk of developing breast cancer compared to the one who started late and ended early,
Mm.
right?
Mm.
So these are some of the non-modification,
Okay.
non-modifiable risk factors.
Right.
Then we have those that are modifiable.
Mm.
A lot of these are lifestyle, for
Mm-hmm.
example, sedentary living,
Mm.
obesity,
Okay.
alcohol abuse,
Mm.
um, abuse of oral contraceptive pills.
Okay.
Um, if you are smoking,
Mm.
if you are doing these things, especially if you have a family history of breast cancer, then you are also increasing
The
your own
chances.
chances
Right. Mm.
of developing breast cancer.
Okay.
Right. So these are some of the risk factors that are associated with breast cancer. Let me also say that
Mm.
women who have had children
Mm-hmm.
and have breastfed children
Right.
are less likely to develop breast cancer compared to women who have never had children or
Okay.
women who have children later in life, say over the age of 35 years.
Right.
They will have a higher chance of
Mm.
developing breast cancer.
Mm.
And
Mm.
also women who have never breastfed a child also have an increased risk. So breastfeeding is actually
Is
protective against
right. Right.
breast cancer.
Right. Well, we're speaking to Dr. Edward Djang, family medicine resident at Korle-Bu Teaching Hospital, walking us through the whole issue surrounding breast cancer. Now, tell us, what are some of the common signs aside the common one I know now is about the lumps. Yeah, have you found a lump in your breast? Quickly rush to a center. Aside that, what are some of the common signs of breast cancer?
Right. So finding a lump in your breast is a good place to
Mm,
start
okay.
from. Not every lump in the breast is cancerous.
Okay.
But
Right.
you are better off not staying home to make assumptions. So
Mm.
once you find a lump or anything of the sort in your breast, please
Okay.
report quickly.
Right.
Particularly because when you talk about breast cancer, with those who have lumps in their breast, a lot of times from the beginning it's not painful, it's painless,
Mm.
right? By the time you start feeling pain, then it means it's advancing.
Right.
So don't be your own doctor,
Mm.
so to
Mhm.
speak,
Mhm.
at home.
Mhm. Mhm.
Once you find something in your breast, please report. So
Mm.
you may find a lump which may be painless initially and painful later on. You
Right.
need to report. Sometimes you also find that the breast is increasing in size,
Okay.
because normally when you look at the breast, there's a little difference in the size,
And
a
the
little
size. Right.
asymmetry. One is
Mhm.
slightly bigger than the other.
Right.
But if you notice that the difference in size is becoming more pronounced,
Mm.
you need to report to hospital immediately.
Right.
If you notice that the skin overlying the breast is changing, it's becoming more reddened, it's becoming dimpled, there are some holes that are developing in it, it's beginning to look like the skin of an unpeeled orange,
Mhm.
you need to report.
Mm. Mm.
If your nipples normally face outward, and now you notice that one of them or both of them are facing inward,
Mm.
especially when you cannot push them back outward,
Mm.
you need to report that to hospital immediately. That could be a red flag,
Okay.
that you are dealing with something sinister.
Right.
Also, if you are having nipple discharge, you are not a breastfeeding mother,
Mhm.
and you are having nipple discharge of any color, particularly if it's bloody,
Mm.
it's
Okay.
a red flag. You need to report
Right.
to hospital immediately.
Okay.
If you notice any lumpy feeling in your armpit or around
Mhm.
your neck area, that could also be a sign, even if you
Okay.
don't have any breast symptoms at that point.
Right.
Once you are feeling those lumpy things in your armpits, you need to
Okay.
report to hospital to get it checked up
Right.
as soon as possible.
Right, that's great. Thank you for that clarification. So, but then there's this issue about men assisting their wives to, for more of like the home check thing. How do men do that? How are they supposed to do that?
Right. So, I assume you are talking about the breast
Yes,
examination.
yes, the examination.
So
Yeah.
one of the highlights of the Pink October is teaching people how to do self-breast examination. We're encouraging every woman, every man
Mm.
to examine their own breasts at home,
Right.
both men and women.
Mm.
Now, for men, you're asking specifically about what men can do.
Yeah.
Every man should. I will encourage every man to learn how to examine the breast. First of all, examining your own breast,
Okay.
and then helping your partner,
Mm.
your wife, your girlfriend, to also examine hers. And you can help in one of many ways. One, you could remind them,
Mm.
because we are encouraging them to examine their breast every month.
True.
So remind them,
Mm.
have you examined your breast this month? And remind them to do so.
Right.
Sometimes you may help them to do the examination if they are comfortable enough with you.
Mm.
You After you have examined your own breast, you
Mm.
could also go ahead and examine your wife's breast
Mm.
for her, so that if there is any problem, any anomaly that you
Right.
notice,
Mm.
both of you as a team could report together to hospital and give
Okay.
her that support
Mm. So,
that
is it a myth
that
about
she
the
needs.
when men suck the nipples of their wives, it reduces the chances? How true is that? Well, that's a myth.
You see, I made a point about breastfeeding decreasing
Ah,
your chances of
so
getting breast
suckling in that regard.
cancer,
Okay,
but but breastfeeding a child
it's
is very
different.
different from your husband
Your husband,
fondling,
yeah,
or
yeah,
yes,
yeah.
the physiology is very different.
Mm,
Okay,
mm,
sometimes what may happen is that in the course of sexual excitation,
mm-hmm,
as a man is engaged with the breast of his wife, maybe he may find a lump or something in the breast,
mm. Okay.
and may prompt her to report that to hospital.
Mm-hmm.
But the sexual excitation or the sucking of the breast of a woman by a sexual partner
Mm-hmm.
is not equivalent to breastfeeding a baby, and
True.
therefore the benefits that you get from breastfeeding a baby you do not get from sucking your wife's breast,
That's true.
for example.
That is true. Okay, thank you. So, but then let's talk about what lifestyle choices that one can, stick to prevent people from actually getting exposed to all of these dangers. So actually, this is something we really need to encourage people to do in terms of trying to eliminate this particular canker in our society?
Right. The number one lifestyle choice or plan that I will talk about is the self-breast examination. I cannot
Okay.
emphasize that
Mm-hmm.
enough.
Mm-hmm.
So what we are advocating is that if you're a woman over the age of 25 years,
Mm.
every month in the week after your menstrual period, choose
Mm-hmm.
a day and examine your breasts. Now,
Okay.
if you start now, you get to the benefit you get is you get to become acquainted with how your breasts normally are,
Okay.
so that in future, if you should detect any anomaly, you can quickly pick that up and report to hospital. So every month,
Right.
self-breast examination.
Okay.
Having done that, every year
Mm.
you report to hospital and get a qualified medical person, a doctor, a
Okay.
nurse, a midwife, to also examine, because they are now going to bring their medical expertise into the examination.
Mm-hmm.
So if there was anything that you missed during your self-examination
They
at
would
home,
identify.
this
Mm.
trained person is going to pick it up.
Right. Right.
Right.
Right.
So that's what we are encouraging people
Mm.
to do.
Okay.
That is the number one lifestyle modification that I want every woman, every man listening to me to pick up going forward.
Okay.
And then I mentioned some of the risk factors that are associated with breast cancer. I
Mm-hmm.
spoke about sedentary living.
Yeah.
I spoke about obesity. I spoke about alcohol abuse
Right.
and smoking. Cut these out as much as possible.
Mm.
If you need help in any way to stop, say, alcohol abuse or smoking, there's help available
Mm.
for you. Keep an active lifestyle. Exercise according to your strength as much as you can.
Okay.
Eat healthy.
All right.
Eat more fruits. Eat more vegetables. And because as you do this and build your immunity,
Okay.
you are going to be able to better
Absolutely.
withstand some of these things.
Okay, all right. Okay, I think I'm done with mine, but my colleague Mame has a question for you, so we can wrap it up.
Sure.
Mame, doctor is here.
Hi, Doc.
Hello.
Okay, so when you were mentioning the causes, I heard abuse of oral contraceptives. Could you please clarify on that?
I'm sorry. I couldn't hear that.
Yeah, she's talking about the fact that when you were mentioning the causes, you talked about abuse of oral contraceptive. If you could elaborate more
Mhm.
on that.
Yes. So oral contraceptive pills are hormonal pills, right?
Mm-hmm.
Particularly those that contain and work through estrogen, right?
Okay.
Now, if you are taking these pills and you are having a lot of exposure to estrogen, the breast are the environment of the breast are very hormonally sensitive, right? So if you abuse these drugs, then you're exposing the breast to a lot of hormone activity. And with time, you may have the cells in the breast responding to the hormones, and that can develop cancer. That is not to say that oral contraceptive pills should not be taken, but they need to be taken under the supervision of a qualified medical person.
Mm.
So if you need to take them for, say, family planning, make sure that you are taking it under the supervision of a trained family planning health provider,
Right.
so that they can properly monitor you. If you are taking them for, say, some bleeding activity, make sure that you are taking it under the guidance of a trained medical doctor or a gynecologist, because these persons are trained to properly monitor you. But for you to just take them at will as and when you want,
Mm.
that is what you want to guard against, because then you can never tell when you are entering into a danger zone.
Right.
I hope I'm clear on that. And it's much the same with many drugs that we take. A
Mm.
lot of drugs are helpful, but the moment you begin to abuse them without the proper supervision of a trained person, then you are going to end up having some trouble one day or another.
Right. Okay. All right. Thank you, Dr. Edward Djang, for joining us and help us understand at least the basis and encouraging us with your recommendations on how we can do things and adopt lifestyle choices to enable us tackle this particular cancer. Thank you once again, and we hope to speak to you again in the future.
Sure. Thanks for having me.
Right. So yeah, here we go. So we just spoke to Dr. Edward Djang, family medicine resident at Korle-Bu Teaching Hospital. Quite an interesting conversation right there. Hafiz,
Yeah.
Doctor walked us through.
Yeah, he's touched on
He knows his bits, right?
yeah, quite
Right,
interesting things.
right,
Yes,
right.
some we already know, but hey,
Mm-hmm.
I mean,
As a professional,
you need to consistently, refresh whatever it is
absolutely,
on some of these subjects.
absolutely,
And
absolutely.
he's touched on quite a bit. Yes, went on to mention just especially in terms of the lifestyle choices,
Okay.
because there are certain situations where you realize that there are hereditary factors that
Mm-hmm.
I mean it's something you can do very little to nothing about.
Yeah, yeah, yeah,
Yes,
yeah.
especially when your genes are involved.
Mhm.
Yes, there's a family history,
Yeah.
basically speaking. But he's also mentioned some other behaviors that definitely, increases your
Your
chances.
chances of
Smoking
getting, yeah.
and
Alcohol,
alcohol and everything.
yeah.
Yes, and good thing Mami also wanted clarity on
The
the
contraceptive
contraceptive
bits,
bits.
yeah.
Yes, because what it means is that if you are fond of popping pills every now and then,
Mm.
well, you might actually be doing more harm than good. So
To yourself, right.
it's good that
Mm.
he's cleared all that up.
Mm,
Yes,
mm.
and the bit about the men. Yes,
Yeah. It doesn't.
yeah.
Don't oversuck thinking that's gonna help your wife or
I actually
anything.
caught this radio. I don't know if I should call it advert or what. I mean, some form of
And it was
education
encouraging.
drive. Yes, and they had this interesting slogan: "Suck
Yeah.
and check." So
Now, wow.
yeah,
Suck and check. Right.
yes, so
Okay.
it sounded catchy, but I mean, we know how slogans work in this country.
Mm,
One this, one that, one this, one that. So
I know,
I mean,
right?
if
Yeah.
you have a catchy slogan, it goes a long way.
Suck
You
and
never
check.
know. So when you say suck and check, someone like, what do you
What's
mean?
that?
Then
I'm
it's
curious, huh?
exactly. So
Right.
that's a bit about that. Anyway.
Okay. Yeah, mommy.
Barry.
Yeah, you sounded so interested about the oral contraceptive thing.
Yeah, I knew you were going to ask me that
Why?
because I know you're going to ask me
No.
that.
Come on. I was just trying to find out. I mean, he spoke about an array of courses and stuff. But I think it's okay to want to find out more because as a woman, definitely, is an area that I think the ladies are the ones that actually take the contraceptive stuff, right? They do the pills and the what's the injection and da.
Yeah, the IUD.
Yeah, the implants, those
yeah.
stuff. Yeah. So
But
fair
I
enough.
was asking because when I was in the university,
Okay.
one of my lecturers, I think my environmental health,
Mm-hmm.
something, one of those courses,
Yeah.
lecturer, she talked about how
Did you pass that course?
She didn't attend lectures. She didn't attend lectures, so forget it.
So skipping lectures.
I wasn't.
Hi, my friend.
Friend, behave yourself.
She, ah.
Don't say anything.
You're
again.
skipping
Yeah,
classes.
yeah. No, we
Okay.
know.
Okay, so she used to talk about how taking these contraceptives
Okay.
increase your chances of getting cervical cancer.
Okay. All
But
right.
she didn't make any reference to
To
breast
breast cancer,
cancer.
okay.
And then we find ourselves in a day in an age where people, instead of having protected sex,
Mm-hmm.
will go raw and then
Start taking these pills.
take
The
an
after pill.
emergency contraceptive after because
Yeah.
it's available.
Mm.
I mean, one time this man was talking about how he happened to eavesdrop
Okay.
on a conversation of two young girls, and one was telling one about how she just takes the morning after pill like
Charlie.
drinking water. It's like
Do you have sex every second?
it's
Oh,
like
like-
instead of having, because this one would just fix it, they would just
There's
Charlie.
this
do
very
unprotected
popular one.
sex. And
Should I mention it?
which one are you going to
I
mention?
read about it before
Postino
you asked.
or Lydia
Post
It,
office.
or
Postino
Level
too.
2
I know.
or
Postino
which
too.
one?
Postino too.
That's like the popular one they say.
Yeah.
Postino
Okay.
too.
So there's Postino, Lydia, I know Level 2, and I know there are a couple of others as well.
Right.
Sensei, please.
I'm a woman.
Take us to
duh.
school.
But I'm just saying, it's
All
like,
right.
so then, if you continue abusing these things, then you should know
there are
that
side effects.
you're
Clearly.
increasing your chances of getting breast cancer. So why not
Yeah.
just have protected sex?
Or even stay away and become a what?
Haven't
a
you-
nun
see-
or something. I don't know.
See, haven't you? I've seen a couple of things where I've seen a couple of videos where they talk about if we tell you to stop having sex now,
Uh-huh.
we know we are deceiving ourselves because you will not. You will
Yeah.
tell us body don't be firewood.
Charlie,
So,
man.
so just protect yourself.
All right.
And that is why I needed clarification because
Okay.
usually when they talk about, he was talking about
hormonal.
Taking not taking oral contraceptives not under without medical supervision. And I think taking emergency pills falls under that because you could just walk into the pharmacy, get it, swallow it, and then you're good.
You're good to go.
Yeah, so that's why I needed clarification on
Right.
that.
There was this rapper some time ago. I think in his verses says the stubborn what do you call it, seaman, regardless of the post, he is definitely gonna swim through. It doesn't matter. All right, the show is Africa Daily on Africa Global. I think this is all we have for our discussions on for today as we mark World Breast Cancer Day. So if you haven't checked out yet, please do so. If you don't really know how to do it, please get a professional person to help you out. Just run to the nearest clinic. Tell them I am here to, get you check my breast. If you're a man or a woman, you can go do so.